West and Franklinton area commissioners, the Franklinton Board of Trade and Development Association, Franklin Township and Franklin County, and our city departments, the Department of Neighborhoods, the Department of Health, the Department of Development. It is a great day here in the city of Columbus. You've heard me say many times my top priorities, top three priorities are neighborhoods, 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 and they're the foundation of our city, the building blocks of our success. When neighborhoods thrive, Columbus thrives, and we're on the right path. But we still have much progress to make. For generations, unfair policies kept some families and neighbors from sharing the opportunities others enjoyed. The barriers we see today were built over decades, and it will take sustained commitment to remove them. We must be intentional about building a future where every neighborhood has the investment, opportunity, and support it needs to succeed. We must bring to bear all of our forces of good. We've already proven that we can. In the past 10 years, we have developed dedicated community plans to lift three of our neighborhoods: Linden, the Hilltop, and Eastland. We heard from thousands of residents about their needs and aspirations for their neighborhood and made recommendations for how to bring them to life. And then we took action. Since these plans have been created, the city and our partners have invested nearly $765 million in these three neighborhoods. We've tackled tough challenges and improved the quality of life there. In Linden, for example, home ownership has risen to 42% and crime is down 22%. At the Hilltop, the median household income has risen from $29,000 a year to $51,000 a year, and crime is down overall as well. In Eastland, there are 135 new acres of new parks and trails, and crime is down nearly 15%. Our efforts have revealed what happens when residents, community organizations, businesses, health providers, schools, and government collaborate with a shared vision. New investment, new opportunities created for families, real progress because the work was shaped by the people who live there. Today, I'm pleased to tell you that we will begin a fourth community plan centered right here on the southwest side of our city. I have charged a team led by the Department of Neighborhoods to engage with the community during the next 10 to 12 months. Our team will define and clarify how we can improve health, safety, transportation, educational equity, academic and economic development, and job creation right here in this community. Let's talk about how we got here. In the last few months, we won the opportunity to bring professional women's soccer to Columbus. It was an important achievement that's part of my Ignite Her vision. It will enable our girls to see themselves represented at the highest levels of sport and learn to lead. As we work to bring a team here, the city and county pledged to develop a world-class training facility for our new women's team. It was a necessary part of the public-private proposal to secure the NWSL team that I can't wait for the residents of this city to help name and cheer on. That facility will be located on the land that is now McCoy Park, not far from here. I understand why this was perceived as a loss for the area, but we are making great strides in our collective efforts with the community to develop plans to create new park spaces in the community. A working group is hard at work on that project as we speak. But I think it particularly stung because this community has experienced loss and neglect and systemic disinvestment for far too long, similar to the things that Linden, the Hilltop, and Eastland faced as well. Today, the life expectancy of residents in this census tract is only 60 years, the lowest in the state of Ohio. No city should accept that, and Columbus is certainly not going to. And as your mayor, I certainly will not accept it either. Friends, a park cannot rectify the complex issues that underpin such an alarming outcome. Much more is needed. And while we're intensely committed to creating new park spaces here, there is so much more for us to do. That's why our team will build a comprehensive community-driven plan with a long-term financial commitment. We're not here today to tell Southwest Columbus what its future should look like. We're here to listen. Residents will help create the vision and identify the priorities and opportunities that matter most to them, just like the residents of Linden, Eastland, and the Hilltop have done. This plan will be the start of a new chapter in this community's story. The people who live here, those who worship here, the businesses who continue to invest here, will help define what success looks like, and together, we'll build the roadmap to get there. What matters most is we're going to improve quality of life and health outcomes here, so that when you live doesn't determine how well you learn or how much you make or how long you live. Equity means every neighborhood should have a tailored approach to sharing in our city's prosperity and success. As we move forward together, this won't be the last neighborhood plan, because there are still more neighborhoods that deserve this kind of support. But today, I'm excited to be here. I know this area already has everything a great neighborhood needs: strong families, dedicated residents. It has pride and resilience. I understand that trust is not built by speeches or promises alone. It's earned when people see real results in their neighborhoods, the type of trust we've built in the Hilltop, Linden, and Eastland we want to bring to Southwest Columbus. It's earned when people see real results in their neighborhoods, when commitments are kept, and when government consistently follows through. Residents should judge us not by what we say, but what we do. Whether we make the investments we promise, deliver measurable progress, and make a meaningful difference in people's daily lives. What we're announcing today will help this community with the same focused attention and sustained investment that has helped us transform other parts of our city. Because the Columbus success story is not complete until every neighborhood is part of it. Thank you. I look forward to building the future together. Now I'd like to bring up Columbus Health Director, Dr. Mashika Roberts, to talk about how our Center for Public Health Innovation assisted us in defining the work ahead. Dr. Roberts?
Well, thank you, Mayor Ginther, and good afternoon, everyone. Columbus Public Health is proud to work with you, Mayor Ginther, Director Douglas, and all the community members that are here and that live in this area to ensure that every resident in this community and in every community across our city has the opportunity to thrive and live a healthy and safe life. This plan will ultimately create exciting opportunities to improve a community that's already wonderful, but unfortunately has suffered from some of the lingering effects of redlining and decades of disinvestment. The needs and the opportunity are great. When the mayor asked Columbus Public Health to join in this effort and to look at this area with a public health lens, my team eagerly jumped to learn more. What we discovered is that this area is diverse, with multiple neighborhoods, and the overall needs of this area reflects that diversity. one thing was clear. Our neighbors on the southwest side do not have the health opportunities they need. And there is a sense of urgency to address the underlying factors that are contributing to that. To help inform the process, Columbus Public Health Center for Public Health Innovation looked at data to assess and find areas of greatest need. Our team used GIS technology to understand the Southwest Area Commission boundary, as well as additional census tracts. We also used the 2023 Health Opportunity Index and Life Expectancy Map. This information allowed us to better understand the social determinants of health and how they drive health opportunity and life expectancy at the census tract level. The findings were complex, but it was clear that this area reflects the relationship between health opportunity and life expectancy. So life expectancy, even within this area, is very broad. It includes the lowest life expectancy in Central Ohio. So depending on where you live in Southwest Columbus, your life expectancy can be as low as 50 years and as high as 74 years. But when we compare that to the life expectancy that's just about a 20-minute drive away, their life expectancy is 88 years of life. So there's definitely work that we can all do together to improve the life expectancy right here. And just like the life expectancy, there are opportunities for good health change, depending on where you live in this area. Some neighborhoods have very high life expectancy, but the opportunity to achieve optimal health outcomes is low. That is contributed by things like overcrowding, workforce participation, employment access that is drivable and accessible, and all of these are the social determinants of health that we at Columbus Public Health look at and think about for all of our community. We need these things to be optimal so that we can all have optimal health. We found that these social determinants of health can be addressed, and we have the infrastructure in our community to make sure that we help this particular community address them. We also discovered great opportunities to address other social determinants of health to improve our health outcomes. For example, only 35% of residents in this area who are 25 years of age or older have a high school diploma or equivalent. The infant mortality rate and preterm births are the highest and are higher in this area than in other parts of Columbus. And the prevalence of diagnosed diabetes, heart disease, high blood pressure, as well as cigarette smoking are also higher in this area than the rest of Columbus. So that doesn't sound like good news, but again, the good news is Columbus Public Health and other community partners have done this in other communities, as Mayor Ginther has shared, and we're ready and willing to do it right now, right here in this community. We have collectively worked with others to improve outcomes in neighborhoods, and we can do that right here in the Southwest area. Columbus Public Health has the tools and the expertise to identify the root social and economic factors which lead to poor health outcomes. And we are ready. We are ready to roll up our sleeves and work with the mayor, you, the residents of the Southwest area, our partners, other city departments, nonprofits, and the business community to bring this plan to fruition. At this point, I'd like to invite Director Douglas from the Department of Neighborhoods to come to the podium. Thank you.
Thank you. Thank you, Mayor Ginther, for giving the Department of Neighborhoods the opportunity to do what we do best: intentional community engagement, listening to our residents' concerns, and then helping to collaborate on solutions. Thank you, Dr. Roberts, for providing the data behind the leading causes of death in our community. This is a moment of clarity that none of us expected for the fastest growing city in the state of Ohio. But the truth is, the neighborhood that we currently stand in has a life expectancy rate of 60 years of age. Said another way, The likelihood of a resident in this neighborhood that we are currently standing in celebrating a 70th birthday is almost impossible unless we answer the moment of clarity with action. That is what this plan brings to the table. In order for this change to become reality, action will be required by every stakeholder in the area, every person, every organization, and every business owner. We did not arrive at this moment in time overnight, and the plan to recover from the harm to the community won't be instant. The urgent work, as Dr. Roberts stated, begins now, so that the children in this community have an increased possibility of living longer, healthier lives. I'm excited to begin the discussions with stakeholders, and I'm proud to lead the team that will shepherd the process to change the reality of life expectancy for residents living in the neighborhoods identified as Census Tract 51. So a bit about this process. The community can expect robust and intentional community engagement. As the mayor mentioned, the department has completed 3 plans across the city. Each of those plans garnered multiple community engagement opportunities. Our most recent plan in the Eastland area had a footprint of 6 square miles and a population of 20,400 people. The engagement touched 1,800 residents over a 12 to 18-month period. The details of the community contact will be tailored for this plan area and will happen in phases. In the previous plans, the interactions with the community has included events such as a local kickoff event, pop-ups at local trusted places like grocery stores, or Ari's Diner, the library, or Bumble's Backyard, which we have here in the audience today. The conversations often happened in focus groups and community plan office hours that will be located at places familiar and convenient to you to urge your participation. The goal of each interaction in the first phase is to hear from you. We want to hear what's going right. We want to hear your assets. We want to hear your treasures. We also want to hear what needs improvement. But most of all, we want to create a long-term plan that does not sit on a shelf. A plan that is informed by and filled with community voice, so that it inspires our current and future residents to lean into the work. As in each of the previous plans, an RFP will be created, released, and awarded to a consultant to manage all phases of the project. With each plan, the footprint and engagement will look a bit different. We are clear on the data we heard today, and it does not favor a process as long as those that we have typically engaged in. It is our goal to finish well below the threshold of 12 to 18 months. The city, this administration, values the voice of the community, and this department is here to partner to ensure that this work gets done. I would like to take a moment to introduce some of the staff that will be working on the plan. In the back of the room, we have Patrice Allen Brady. As the community will know, Ola Bisi, Eddie, and sitting here in front, Vanessa Mora. They've been the team that have been on the ground talking, having the conversations that allow us to now step into this moment of clarity in a way that will allow the community to have a voice that you will see in these pages. Now it is my pleasure to ask Leah Young, Fiscal Chair of the Southwest Area Commission, to say a few words, followed by C.D. Aiden, South Franklinton resident and advocate.
Good afternoon. My name is Leah Young, and I am proud to be here representing the Southwest Area Commission, our neighborhood, and our neighbors. I want to start by thanking the City of Columbus for their commitment to complete this 4th community plan that affects us personally. A tremendous amount of work has already gone into the planning effort, and I want to recognize that the residents and stakeholders who have spent countless hours sharing their experiences, concerns, and hopes are for the future of our area. Today is an important milestone. For too long, the Southwest area has been overlooked despite being home to some of the city's most vulnerable residents. The community has faced generations of disinvestment, inadequate infrastructure, limited access to recreation, green space, and healthcare, leading to some of the most significant health disparities in our region. The creation of a comprehensive community plan is an important step forward. It provides a vision, a roadmap, and a shared understanding of what residents want and need their neighborhoods to become. But today, I want to respectfully challenge all of us, because the true measure of success will not simply be the completion of the plan itself, but whether its recommendations will receive the necessary funding and whether all parties remain committed over the long term to the work required for successful implementation of the plan. As we celebrate this milestone, I call on Mayor Ginther and his administration and City Council to make public commitment that this plan will not become a document that sits on a shelf while residents continue to wait for sidewalks and parks or housing improvements, transportation investments, economic development opportunities, and access to basic services. The Southwest area deserves more than a vision. It deserves investment. That investment must come from multiple sources. It should include meaningful funding commitments from the City of Columbus through future capital and operating budgets. It should leverage public-private partnerships that bring new resources into our neighborhoods. It should involve Franklin County commissioners, townships, the great state of Ohio, philanthropic organizations, and other stakeholders who share a responsibility for improving outcomes in our community. Most importantly, it should be inclusive, transparent, measurable, and accountable. Residents should know what projects are being funded, when they will occur, and how progress will be tracked. They should not have to wait a decade wondering whether these promises made today will ever materialize. I believe this administration has an opportunity to set a new standard and to rebuild our trust, not simply by planning for historically underserved neighborhoods, but by demonstrating the political will to invest in them. The Southwest area has waited long enough. We, the Southwest Area Commission, stand ready to partner with the city, the county, businesses, nonprofits, and community organizations to turn this vision into reality. We will continue to advocate for our residents, celebrate progress when it occurs, and hold ourselves and our partners accountable for delivering results. Today, we celebrate the plan. Tomorrow, the work of funding and implementing this plan must begin. Thank you.
Good afternoon, everyone. My name is C.D. Aiden. First, I want to thank God for giving me the opportunity to stay here today and speak on behalf of a community that has spent too long feeling unheard. I want to tell you a story about a little boy. That little boy was me. I grew up in South Park. I walked these streets. I played in these parks. I saw things that no child should have to see. As a child, I didn't understand why our neighborhood looked different. I didn't understand why it felt like people drove through our community instead of stopping in it I didn't understand why it seemed like the rest of the city had opportunities that we didn't. What I did understand was what I saw every day. I saw a struggle, I saw poverty, I saw single mothers carrying the weight of entire families on their backs. I saw trauma, I saw addiction, I saw depression, I saw violence. And I saw young men from my neighborhood lose their lives to gun violence before they ever got a chance to discover who they could become. Young men who had dreams, young men who had families, young men who should still be here today. Every one of those losses left a hole in our community. And every time we buried another young man, it felt like we were losing a piece of ourselves. When people look at our neighborhood, they often see statistics. I see faces, I see names, I see people I grew up with. I see stories that ended too soon, but that's not all I see. I also see children riding bikes through these streets. I see kids chasing soccer balls. I see laughter. I see resilience. I see hope. Because somehow, despite everything they face, our children still find some reason to smile. And that's why I'm standing here today, because our children deserve more. If you look around South Park, what do our children grow up next to? A cemetery, a mental health facility, shelters, crisis centers, warehouses. When those are the landmarks surrounding you every day, it's hard to imagine a future filled with opportunity. Yet our children continue to dream anyway. That's why this community plan is so important. It's long overdue. For years, the people of South Park and South Franklinton have waited for meaningful investment, not handouts, not sympathy, investment. Investment in education, investment in health, investment in mental health, investment in housing, investment in families. Investment in opportunities that allow people to build wealth and create a better future for their children. Because nobody should be born into a neighborhood where success feels like the exception instead of the expectation. I also want to talk about the places that helped our kids going. Places like McCoy Park. Many of our children don't feel safe playing soccer in their own neighborhood, so they walk to McCoy Park. That field is more than grass. It's where we've won championships. It's where friendships were built. It's where kids learn confidence, discipline, teamwork, and leadership. It's where children forget about the struggles waiting for them at home and get the chance to simply be kids. And then there's Sullivan Gardens Recreation Center. To some people, it's just a small recreation center. To us, it's home. It's where many of us grew up. It's where memories were made. It's where relationships were built. Yet for years, it had felt forgotten. When we visit larger recreation centers, people laugh when they hear where we're from. When they hear Sullivan Gardens, we're often treated like the laughing stock. Like our community doesn't matter. But let me tell you something. We matter. Our children matter. Our families matter. Our dreams matter. And our futures matter. The people of this neighborhood are not looking for someone to save us. We're looking for someone to believe in us. We're looking for the same opportunities that every family in the city deserves. We're looking for a future where a child's zip code doesn't determine their destiny. I stand before you today as the little boy who grew up in South Park. And when I look at the children in this neighborhood today, I see myself. I see future doctors, future teachers, future business owners, future athletes, future community leaders. The talent is already here. The potential is already here. The people are already here. Now it's time for the investment to be here too. My hope is that years from now, people won't remember today as another press conference. They'll remember it as the day our city finally looked at South Park and South Franklinton and said, "We see you, we hear you, you matter." And most importantly, your children deserve a future worth more dreaming about. There's a quote that I stand by. It's united we stand, divided we fall. I appreciate everybody coming here today. Thank you all.
Thank you, Leah and CD, for your engagement. Thank you, Dr. Roberts and Director Douglas, for all your work, not just that is beginning here on the southwest side, but incredible work that's been led in Linden, Eastland, and the Hilltop. With that, we'll be happy to take questions from the press about today's topic. If you have questions on other topics, I'm going to let the folks that are up here with me get on with the rest of their days, but I'll stick around and answer any question about any topic. Any questions from the press about the plan? Yes?
How much money are you putting into the southwest side of this plan?
Well, there's been a significant, I'll let Director Douglas maybe talk a little bit about what money has been spent on the development of the plans. It's been done in partnership with the Neighborhood Design Center, and we may be working with a different partner on the Southwest Area Commission plan, but I'll let her talk about that. The significant part about it is it really is the roadmap for me to go to the private sector, nonprofit, other philanthropic leaders and say, this is where we need you to invest. This is what the community has laid out. It's the reason we've been able to add a grocery store and a pharmacy in Linden, a grocery store to replace the Kroger that went out of Eastland, and have added the Hilltop Early Learning Center, because before that program started, the Hilltop had the lowest number of 4-year-olds enrolled in high quality early learning in preschool. We've tripled the number of kids that are enrolled because of the Hilltop Early Learning Center. So the planning process is critical. We ask for folks' patience and commitment. There have been very skeptical neighbors in those neighborhoods because they've been part of lots of planning processes before. But I let them know this is not going to be a plan that sits on the shelf. We're going to act on it, and I think the record speaks for itself. $765 million that's been invested by the city and other partners into the Hilltop, into Eastland, and Linden, and dramatic quality of life improvements of those become because of that. But Director Douglas, you want to speak to the plan and costs and what we've spent in other neighborhoods?
That number is unknown at the moment. As I mentioned during the process, we will put out an RFP. In the past, it has been dependent on the square footage, the population of the footprint that is decided upon, and a number of those decisions are still to be made and will be part of the community engagement. It is not. And so the focus here, as you heard about the social determinants of health from Director Roberts, is our focus is Census Tract 51, which straddles Franklinton as well as the Southwest Area Commission. And so that is our starting point. We know that it could be a ripple effect from that point, but our goal is that we attack, if you will, that seemed a bit strong, that we attack that low life expectancy. We want the kids at Miss Tammy's elementary school to have a different reality when they hit 60, that they expect to live longer. And so the emphasis is that census tract, which straddles both, and from there we'll decide north and south as we go.
Set a goal to have this plan done over the next year. What about a goal timeline-wise for when investments will start coming into this community?
I'm sorry, what was that?
You set a year-long goal to do the plan. What is your timeline for investments to start coming in?
We're going to start investing right away. And as part of, I said, part of our commitment to this community is not just that there are going to be some great public amenities at McCoy Park as that is developed, but we also are working very closely with partners to identify another major green space that we will plan and invest in quickly. I'm also going to be asking the private sector and other partners in this community to step up and to make some investments into some things that are identified quickly. We've already heard a number of things from the community about what they would like us to address. We can start working on those things as they put together and develop that more comprehensive plan, but we do not intend to wait to invest until the plan is completed. We will just continue to invest more and bring more folks to the table once that plan has been completed. And I've told people repeatedly, this is a both-and community, not an either-or. There are going to be incredible public amenities at McCoy Park, and we're going to identify another park with incredible green space and investments for programming there as well. And we're going to launch this Southwest Area Commission plan, which has made huge differences in the neighborhoods. We've done these plans in partnership with neighborhoods around this city. So I think we need to continue to build upon our partnership and commitment to the community, but we can do all these things together. We've done it before, we can do it again. We appreciate your voices, we appreciate your action. You matter, and we're going to continue to earn your trust and work together. Thanks, everybody.